The guiding principle of primum non nocere, meaning first, do no harm, has underpinned the practice of medicine since ancient times. However, there is now overwhelming evidence that significant numbers of patients are, in fact, harmed from healthcare, resulting in increased lengths of stay in hospital, permanent injury, and even death. It is estimated that up to 17% of patients, which is 1 in every 6 patients, admitted to hospital experience one or more preventable adverse events. Although less frequent, adverse events in primary care are also a concern. There is widespread acknowledgement that medical error is a leading cause of harm to patients. In fact, recent research evidence suggests that medical error is one of the leading causes of death in the United States, and there is evidence that medical error is under-recognized in many other countries also. However, we also know that healthcare staff do not intentionally harm patients. Usually, faults deep within the system of care lead to unintended events or harm. The past 10 to 15 years have seen major advances in our understanding of preventable adverse events in healthcare. There is now a well-established patient safety movement, which has emerged from a recognition that there is too much harm in healthcare. However, focusing on medical error alone may be misleading. If we consider events such as complications in surgery, infection from overcrowded hospitals, adverse drug reactions, or problems with implantable devices, in many cases these are not caused by error per se, but nonetheless are widespread forms of harm. It is clear that a broader conceptualization of patient safety, one that encompasses all sources of harm, is required. The goal of patient safety is to eliminate all forms of preventable harm in healthcare. To do this, hospitals must be able to identify and manage risk. Evidence from other high-risk industries teaches us that risk management requires an active approach whereby potential risks are identified before they culminate in an adverse event. In other words, hospitals should actively seek out errors and failures and use this knowledge to improve systems and processes. Good incident reporting is essential to this process. As doctors, we have a professional responsibility to report adverse incidents and to actively participate in incident reviews. Now take some time to consider the following. Think about the common problems and failures that occur in your workplace that could impact on patient safety. What individual, systemic, or cultural conditions support their continuation?